All righty. So, like I said, I like to start on time, and on time is now. So, I'll get my intros out the way. Thank you, everybody, for your time and your patience. My name is Akira. I am the owner of Take Care of You LLC. We are a perinatal organization that supports pregnancy and postpartum education as well as postpartum support. We have been established since 2022. We have some amazing things coming up, and this is one of our newest events called Can We Talk, a brunch series where we discuss things related to pregnancy and postpartum and everything around. And we would like to bring in specialists in their areas because I don't know it all. And so everybody has their own specialty and niche. And so I am excited for all of these professionals to be on with us today to give us their information, their insight, and their take on everything. I do want to get out the way my thank you to my partners in this event. We have Erica Pulliam, which is part of the Partum Tribe. We have Danica Rainey with My Coda Bear, as well as the Birth Equity Alliance for allowing us and supporting us in this event. We had to pivot and shift, but we are grateful anyway. Also, just a quick reminder, we do have products and services. So if you want to check those out, you can go to our website, which is www.takecareofulllc.com. We have books, we have other services which will support your pregnancy and postpartum journey. So I figure I wouldn't do the introduction of the panelists and I would let them do that themselves because they know themselves the best. So we're going to start with Naila Veal. She is from Kinder Smiles Foundation. And my question to you first is, who are you and what do you do?
Hello, everyone, and thank you, Akira, for having me. My name is Nai Veal from Kinder Smile Foundation. I'm the Perinatal Health and Wellness Program Director there. Essentially, we're a dental nonprofit mainly working with children, infants, all the way through senior citizens. Who I mainly deal with is pregnant and postpartum women, and we really raise awareness to the importance of oral health, your dental care during pregnancy, and how that can affect the entire body, as well as lead to birthing outcomes in the overall health of mom before, during, and after pregnancy, and really just telling people and sharing with people that dental care is entirely safe and highly recommended during pregnancy. And this is something that needs to be incorporated into maternal health conversations and prenatal care. So it's so important. And thank you again for having me, Akira.
Awesome, awesome, awesome. Thank you so much for being here. Next on the list is Shadira Chima, our certified nurse midwife. And who are you and what do you do?
Okay, there we go. Hi, everyone. My name is Chidera Chiba. Like Akira said, I am a certified nurse midwife, and I'm also a women's health nurse practitioner. I deal with women prenatally, intrapartumly, and postpartum, helping them navigate themselves through birth, but also I also deal with GYN care. So even if you're not pregnant, I am helping you navigate things such as contraceptive, and anything that deals with being a woman.
Awesome, thank you. Next is Miss Barbara. She is a therapist for Black moms. So who are you and what do you do?
Hi, good morning, everyone. My name is Barbara Neal. I'm a licensed marriage and family therapist and owner of Therapy Black Moms, which is a teletherapy practice in New Jersey dedicated to the mental and relational health of Black mothers from pregnancy to empty nest. I chose this because, as a mom myself, a lot of times in therapy, the focus can be there's a lot of things you can focus on in therapy, but Black motherhood in particular is a very unique experience. So I love my moms, and you don't have to be a mom to obviously be seen here. We see Black women, we see couples, but my focus is Black mothers specifically.
Awesome, thank you. Next is Dr. Nyota Peace. Who are you and what do you do?
Good morning, all. Dr. Nyota Peace, OBGYN with Clifton, OBGYN of Essex. Been practicing about 20 plus years now. I'm also the chairman at Pascack Valley Hospital, so I see both the administrative side and the medical side. And Shadira and I worked together before, so I know some, and we covered midwives before, so I know that aspect of it as well. Um, we cover both maternal and GYN services as well as gynecological surgeries.
Awesome, thank you. And last but definitely not least, Dr. Christina Johnson.
Hello, my name is Dr. Christina Johnson. I'm a family medicine physician, so we take care of everyone in the family from birth to death, from birth, so babies, adults, elderly. We like to see the whole family. And so we help pregnant patients before they become pregnant. We can help during your pregnancy and certainly after we need to see you. So thank you for having me.
Awesome. Thank you, ladies, so much for your introduction. And we're just going to get right into it because, like I said, time is precious. You can't get that back. So if they're late, they're late. But I am recording it so that I can break it up and share it later. So we're going to start with Shadira. So my question to you is, what are some misconceptions about midwifery care during pregnancy and birth?
There are a lot. I would say the biggest thing that I often hear is that do you attend births in hospitals as well, or is it just at-home births? Yes, we do deal with low-risk pregnancies, and our mantra sometimes deals with holistic work, but we do deliver babies in all sorts of settings, birth centers, hospitals, and even, of course, at home. We're able to provide care in all aspects. Even if you are a mom who prefers pain management, we're not only working with moms who want to do things pain-free or not pain-free, but want to do things without medication. We're also servicing moms who still want to have autonomy in their care, but also want to make sure that they are comfortable as well.
Awesome. Thank you. Barbara, how do you integrate therapy with medically and holistic care?
That's a great question. I like to think of therapy as a part of your care team, the same way you would have a family doctor, a OBGYN, there's physical health and there's mental health. And so I think that therapy plays a role in making sure that you are taking care of yourself, and focusing specifically on you to get your space to see that you have the tools and skills to get back to adjust to the new you as a mom, and just, manage the stressors and things that are going on in your daily life, whether it's your relationships, your job, adjusting to a new baby, second or third baby, a loss, anything like that. And so I like to tell people, if you think of all the doctors you have for your physical health, a therapist is who you need on your team for your mental health. And so we are a part of that whole care team.
Awesome. Dr. Pease. So we deal with birth plans all day, every day long. How do you balance the patient's birth plan with the medical necessities of labor and delivery?
Well, first of all, with the birth plan, I recommend that they bring a birth plan at the beginning of the pregnancy because not all physicians are on board with certain things that patients want. A lot of patients want more of a holistic stuff with midwives, but still want physicians. So it's better to show us ahead of time so we can go over it. Birth plan should be more of a guide, a better way of communicating between the physician and the patient, and the patient will have a sense of, what the physician will be able to do, what the hospital allows them to do, and what they're comfortable with. And that way they can make a decision whether they want to stay with that physician or not. You have to understand that with a birth plan is always room for change. It has to be flexible. The patient has to come in there understanding that it's flexible because ultimately the baby makes the decision.
Absolutely. Absolutely. We see that time and time again. Dr. Johnson, how do you play a part in the pregnancy, preconception through postpartum?
So, great question. And when someone is trying to or beginning to plan their family, we start early. We start with speaking with both children, teenagers, adults about their sexual health, about their relationships and evaluating their relationships and how healthy they are. When they're planning their families, we talk about their support network, who's available and around to sort of help. If there are social needs, food insecurity, those kinds of things. We have resources that can be helpful that they can use as they're going about either planning or having a baby. We also talk about age and some of the complications that can happen with pregnancy as women age and sort of how to strategize about that. Often, I'm one of the first doctors that are telling patients about their biological timeline versus their sort of social timeline about how they're planning. And a lot of people planning their families are older. And so we talk about REI or reproductive endocrinology if needed. We talk about pregnancy complications. We talk about the importance of prenatal vitamins and that it may be recommended they take aspirin, prior to pregnancy. And often that's the first time they're, sort of hearing about these things. We talk about genetic risks possibly too. I have a lot of patients who are from the diaspora, and so they may have some genetic issues that need to be evaluated prior to becoming pregnant, both with themselves and their partner. We talk about vaccines and how important it is to go into a pregnancy as healthy as possible, and how those antibodies are going to be very helpful both for you and for your breastfeeding infant. What else? We talk about sleep and how important it is to have good sleep, and whether or not there are other sleep risk factors that may lead to other things like sleep apnea, et cetera, that could lead to other complications. And generally, we try to encourage people to be as healthy as possible going into a pregnancy. Like if you're not exercising now and you're not eating healthy foods now, you can maybe make that transition, sort of heading into a pregnancy, but it's important to sort of lay that groundwork of just eating healthy food, exercising, and sleeping, and having a good sort of relationship pattern, and you're evaluating that. Finally, we encourage people to evaluate their mental health. So if you have depression, anxiety, other behavioral issues that are untreated, it's time to treat them, because it's not necessarily going to just get better because you have this excitement of having a new person in your life. That may not happen, and so you need to make sure that you are optimizing both your physical, your mental, and your spiritual health. We help people with financial resources as well. So we're pretty holistic and comprehensive at approaching people planning their families.
Awesome. Thank you. And Nye, why is oral health so important during pregnancy, and how can poor dental health affect the mom as well as the baby?
Yes. So even if we're not talking about pregnancy through the postpartum period, oral health is something that sometimes get put on like the back burner, right? So a lot of people tend to separate their head from the rest of their body, but the two are largely connected. I can't stress it enough. So here at KinderSmile Foundation, not only are we providing education, raising awareness to how your oral health affects the rest of your body, but especially during pregnancy. During pregnancy, there's a fluctuation in your hormones, which just puts you at a greater risk of developing dental problems. A lot of pregnant moms experience high plaque accumulation, which we call gingivitis. And if that progresses into something worse, which let me say is all preventable, that can lead to periodontal disease. Periodontal disease has been linked, I'll give you a little nutshell, but has been linked to preterm birth, low birth weight, all of these different poor birthing outcomes. And when we talk about improving maternal health and reducing maternal morbidity and infant morbidity, we need to be incorporating oral health into these discussions. And so, in short, if a mom has a high level of untreated cavities or dental problems, even before her child is born, her child is going to be 3 times more likely to experience, let me say, these preventable dental problems. And who are they mainly affecting? Those with and without insurance, which is mainly our Black and brown families, all things that are preventable. So we really place emphasis on education, but also linking mom and baby to a dental home to receive this care, because we know lack of oral health care for whatever reason throughout pregnancy is going to have an effect not only on your baby, but on your entire body from head to toe. Little biology lesson, your teeth are rooted within your gums. In that inner chamber of your teeth, underneath the enamel, blood vessels and nerves. If you have a cavity, which is a disease, which is preventable, you'll hear me say that a lot, and you don't get it treated in time, or you don't have access to a dentist for whatever reason, it goes unaddressed, that disease, that infection can spread to that inner chamber, lead throughout your bloodstream, which connects to your entire circulatory system, affecting your major organs. And in the case of pregnant moms, your developing fetus, your baby, all things that are preventable simply if you have access to a dentist, you're informed about oral health care during pregnancy, and we're kind of combating those myths regarding the fears and all of these misconceptions about receiving oral health care during pregnancy. But I can't stress it enough. It's a part of prenatal care, perinatal care, and it starts even before you get pregnant. So in a nutshell, that's how oral health is important during the pregnancy and postpartum phase.
I know I am a bad person when it comes to the dentist. I mean, the dentists don't get along, but I do know it is definitely important. And, just speaking with you in regards to that, just not understanding how, yes, we understand like the mom is the host and the baby is, inside and, you're feeding the baby, whatever, but not realizing that your oral health is also going to affect your unborn baby.
Yeah.
And you don't think of those things, on a day-to-day basis. So I do appreciate that. One question, how does pregnancy hormones impact gum and teeth? And what should people like look out for?
Yes. So another question, getting into bio a little bit, but we'll kind of make it surface level, is that, like I said, there's a fluctuation in your hormones during pregnancy. It's inevitable. It's something that happens, but that makes you more susceptible to dental problems like gingivitis. When you have gingivitis, that plaque accumulation along the gum line, and it gets a little too unaddressed or too far gone, that can actually start to affect your gum health. So a lot of pregnant women, when they have gingivitis and they don't get it addressed in the earlier phases, or even if it's something that started before pregnancy, that'll present as like tender or swollen gums. And when I'm talking to patients, you'll hear them say like, "Oh my goodness, I just got pregnant. Now my gums are very tender, they're swollen. When I brush gently, they're bleeding a lot," or even like tooth looseness. So when your body is preparing for birth, right, you have your tendons and your ligaments and all of that stuff is changing within your body, preparing yourself to give birth to a child. That does not exclude the periodontal ligaments, which hold your teeth in place. A lot of pregnant women experience tooth looseness, but it shouldn't get to a point where we are actually losing teeth. So signs of periodontal disease, swelling, tenderness, even softly brushing, flossing, you're getting a lot of bleeding. And like I said, if you have all of that bacteria there, direct pathway to the bloodstream, which is going to lead throughout your circulatory system. But in a nutshell, that's basically how like the hormonal levels will make you more susceptible to dental problems, cavities, gingivitis, progressed periodontal disease, and impact the rest of your body, mom and baby.
Awesome. Thank you. Dr. Johnson, what are some screenings that moms should get during the postpartum period that are often overlooked?
Fantastic question, because often it's the case when you have a new family, life is so busy, everybody's so tired, and they kind of forget to circle back. We want to see you within the 12 weeks after you deliver. You may have had complications during the pregnancy that also need to be evaluated, surveyed, and managed. It could be blood pressure issues or blood sugar issues. We want to check in regarding your weight and weight management as well, as your body is changing, and because that can sort of influence some of the other things that can develop. But we're also looking for the basic things. And again, there's some wiggle room here, because if you are breastfeeding, that we do sort of allow a little bit of leeway for sort of checking certain things. But we want to know what your cholesterol levels are. We want to know what your blood sugar levels are. We want to know what your blood pressure is looking like. We want to check you for depression and other behavioral issues that may come up postpartum. We want you to see your dentist and your eye doctor to make sure that there's no issues or changes there. And those are the main things. And for our women of advanced maternal age, we also want you to get your mammograms done. We still want you to get your breast cancer screening in and or colon cancer screening, depending on your age and family history. And we can help with all of those things. Usually we say about 6 months after you finish breastfeeding, if you're on cycle, to get your breast cancer screening done, but we can sort of help with arranging and coordinating that. So those are just a few of the screens that we do.
Okay, thank you. Speaking of just screenings, Dr. Peace, what are some things that warning signs during pregnancy that should not be ignored?
In general, I have to say that patients really have to be their own advocate, because you can have something minor that's going on, and you should still ask because something minor may lead to something major. Uh, but as far as the severe danger signs, it's vaginal bleeding that's heavy like a period, abdominal pain that's severe, that's not coming and going like contractions, but it's a constant type pain. Also, you want to look at headaches. If you have severe headaches, it's not going away with Tylenol. Those are the things you want to look out for because it's preeclampsia, which is a hypertension of pregnancy. You have placental eruption, which is when your blood pressure is so high, which can happen during pregnancy, even if you don't have a history of high blood pressure. And the pressure onto the placenta is so high that it actually separates the placenta from the uterus. And abdominal pain, that could be abruption, that can be swelling of your liver capsule, for preeclampsia. So those are the more severe danger signs. But anything that you're concerned about, you should always call and ask. And we can decide whether it's something that needs to be addressed right away or not. Because most patients, when they're pregnant, they don't know what stuff is serious and what's not. Even patients who have multiple pregnancies, every pregnancy is different. Everyone has a different symptom, and don't blow it off, especially nowadays with such a high mortality rate with pregnancy.
Absolutely. Absolutely. Thank you. And Shadira, how do midwives support patients?
Well, I mean, we're supporting patients in all aspects. Of course, like any other provider, we're helping you navigate pregnancy, the symptoms that you're having prenatally during your visits. You're coming into the office, you're asking questions, and we're kind of helping to validate and also, kind of monitor and go into depth about things that should be happening, things that shouldn't be happening. Of course, during the labor process, I like to say we're the medical side of a doula. So other than making sure that you and your baby are safe, we're providing that emotional support, helping you advocate for yourself during your labor process, kind of giving moms that push to kind of have that autonomy in their birth process, of course, within means of making sure that you are remaining safe and that the baby also is remaining safe. And then postpartum, kind of navigating and making sure that your mental process is there. Monitoring is very important. I often tell women postpartum is very vulnerable. It's kind of like puberty, pregnancy, and menopause mixed together. There are a lot of hormones shifting, and a lot of women aren't ready for that. Everybody prepares for labor, but they're not preparing postpartumly for what to expect. So even that aspect is something that we're helping navigating through postpartum checks. Every person is different. Often you have your initial visit and your 6 week visit, but some women do need more time. And the more visits they have, we're able to kind of delve into that.
Awesome. Yes. And then speaking of the postpartum aspect of it, uh, Barbara, how often, what are mental health support issues that pregnant people or postpartum people should look out for?
That's a great question. So, in particular, someone mentioned postpartum depression. There's a thing called like baby blues, which is like, you're feeling a little sad or down or crying the first few weeks after you have your baby. Anything that persists longer than that, like postpartum depression, can last up to a year. And it could also be postpartum anxiety, feelings of anxiousness, you're worried, you're going to hurt your baby, the baby's going to get hurt. Things like that are really important to look out for. In Black women in particular, though, those things do look different. And so one thing that I work with my clients on is, we present very differently. When people typically think of depression and anxiety, depression, they think like, oh, you're not getting out of bed, you're not doing all these different things. But Black women are unique in that, most of the time we look pretty fabulous. We're getting the things done. And so depression in us can actually look like overperformance. People may see us and we are they may describe us as like irritable, or it may come off as like angry, or we're snappy, or we're hyper focusing on, all of our different children or work or different things. And so, but at the same time, experiencing this internal sadness and depressive state. And so I always encourage people to, pro Black women a little bit differently, because we just present differently when it comes to depression and anxiety. A lot of times we are very much functioning on the outside, but not functioning well on the inside. And when it comes to anxiety in particular, it can also, present differently. People are self-medicating in different ways to kind of cope with the stress and things that they're experiencing. And so that is something we definitely work with moms on. And another thing to consider is, when a Black mom in particular is struggling, depending on her relationship with her provider, they may not share what they're going through, for fear that someone may take their baby, or that people will think they're not doing a good job. Like they think that, our bar is perfection, but this is a hard thing that we are experiencing. And it's okay to talk about that, feelings of like, you might hurt your baby, or you don't really like them right now because you're not getting sleep. Like these are very normal things that come with motherhood, but oftentimes Black women in particular don't want to talk about them or feel comfortable with that. And so one of my jobs is to, gives mom the space. That's what therapy is for. Give them the space to share what they're really going through so we can get the support that they need. And also empower moms with the language to advocate for themselves with their other healthcare providers, making sure they have a family doctor, OB that they trust and that takes them seriously, and that they feel comfortable speaking up and asking more questions, because that is sometimes also a barrier as well, especially if they need, more additional supports like medication or whatever it is, even just support within their own families through their partners, their extended village, just the idea that we struggle sometimes asking for help. And so in therapy, that's one of the things we really work on to help them manage their depression and anxiety. And just becoming a new mom is really starting to speak up in a way that you might not have spoken up before, really pushing yourself when you feel like, oh, people should know what I need, and they don't. And so making sure that we're empowering moms with the language and the tools that they need to advocate for the help and support that they deserve.
Awesome. Thank you. Thank you. Thank you. So we're going to have a brief intermission real quick, but in this intermission,
Sarah, I just wanted to quick. You couldn't have said that better than anyone I've heard, because us as Black women, we used to being the person that does everything and not feel anything. We just do. And our culture really doesn't push for therapy. They push for church.
Yeah, thank you. And I was telling them, I think you need both, right? Because a lot of times, people forget, like they see this baby, but you brought this baby into the world. And a lot that makes me think of something else, is that Black women in particular, we will work through pain. We will work through things that are bothering us, and we just keep going. And I always tell them for years. And I'm like, you're actually not supposed to be in pain. There are actually things that can help you be less anxious or, manage your depressive symptoms. And so just really empowering them that, like, it doesn't mean, it feels like failure. Failure is also something to look for in Black women in particular. We feel like we're failing because, again, our bar is perfection and just to get it done. Everybody else gets it done. Why can't I get it done? And so that is what my role is as a therapist, is to help moms with that, and then connect them with providers who also understand them as well. So I know, like, you could look great and fabulous, and I can be like, what's really going on today?
Yeah.
And so that is really important with us, for sure.
Awesome. You hit my button. You almost saw a tear come out. You definitely hit my button. I do want to acknowledge the two other guests, two other support people that are on right now, which is Erica Foy of the Pardon Tribe. So I would love for her to say something and talk about her business, as well as Danica Rainey to talk about My Code of Bear. So Erica.
Thank you. It's such a wealth of information, a lot of gems to glean from. I am Erica Pulliam, the owner of the Pardon Tribe. I provide postpartum support, to women in the Plainfield community and surrounding communities, postpartum support, just being inclusive of the entire family. If you're there, everybody needs to have a job. We're not just showing up just to look at baby, but what is your job and how do we incorporate all generations into the support of the family system? So it's support, it's rest, it's wellness, it's healthy recovery, and definitely mental health is on the top of my priority list, and advocacy. And what does that look like? How does everybody become involved?
Awesome. Thank you, Erica. And Danica?
Hi, good morning, everyone. Wow, this was just so powerful. And we just only 45 minutes in or so. The wealth of knowledge, like Erica said, is absolutely amazing and taking away so much. My name is Danica Rainey. I'm the executive director of My Coda Bear. My Coda Bear is founded by my cousin Shirley Harris, who had a premature baby at 22 weeks. She weighed 1 pound, and pushing through and navigating the NICU arena and premature labor and birth was different for her. She didn't know. And that was 8 years ago. Dakota, who is the baby that was born premature, is now 8 years old. But 8 years ago, she was like, what is this? What is a premature baby? What is a NICU? I don't know what's going on. And how many more people don't know what's going on? So we started small and just said, okay, let's get the word out. Let's get the information out. So we started initially helping families just in the NICU where they needed baby supplies or some type of support and connecting. But then COVID happened. So everybody needs help. And we didn't want to just help those families of the NICU. So we started helping everyone in the Essex County area. We also are in Ohio where the business really originated, where Dakota was born. And then we started diving more into postpartum depression and prevention. She had our third child 18 months after Dakota, who was the preemie. And so she was deeply in postpartum depression from Dakota, the premature baby, now into the third baby. And myself, as being a close support person all of her life, I knew something was wrong, but I didn't know what. I didn't think postpartum, wasn't educated about postpartum and how long it could last and how I could just help, like give me the kids for the weekend. So we started to dig deeper. We received a grant from the state, and we're now teaching on one end for postpartum depression and education of individuals and birthing population support persons. But also on the other hand, we are coming together with the clinical staff, allied professionals, where we are connecting. Now, we're not educated, we have the lived experience. So we're connecting with such professionals as yourself to connect the dots. And like one of you said, I think it was Barbara, to speak to the families, like, or the mom, like 6 weeks out, it might have been Chidera, to speak to them, keep asking the questions, not just checking the boxes, and so we're trying to use that with the Edinburgh survey and, bringing your professionalism in to that so that we can assist our population better. Thank you.
Awesome. And tell them what's coming up.
Yes, so Saturday is our community baby shower. We have about 67, I think, registered, plus they can bring one person. In our experience over the past 4 years, about half of that shows up, but that's our chance to educate, to have individuals to come around. Kindred Smile is actually coming as well. And we set up resource tables so that these families can get some education. The bait is you get some baby supplies, but you're going to get this education today. So we're aspiring to do a few more here in New Jersey. We call it a traveling baby shower. Actually, we have one in California next month. And yeah, we're on the mission, on the roll.
Awesome. Thank you, Danica. Erica, do you have anything coming up?
I would love to partner with everyone here. Thank
I
you.
am in the process of planning like some summers, like a summer series event. So whether that's look like yoga, some hikes, maybe like a beach day just for moms to take a break. So you could look out on my Instagram page for up and coming events, but a summer series.
Okay. And if everybody could put their information, how we can find you if you are on social, if your business is on social, if it's your personal, don't do it. But if it's your business on social, you can put that in the chat so that way people can find you and get the information that they need. I do want to play a quick game for our provider. Yes, Dr. Johnson.
I'm sorry, I just wanted to just mention this. I'm CPR certified and I'm an instructor as well. And I think it's also important to have families or someone in the family support person, the parents, whoever, aware of how to do CPR, how to help a choking instant, and we're coordinating classes, or if you want a class for your group or your organization, reach out and let me know. Just text Akira, she'll put you in touch.
Awesome. Thank you, Dr. Johnson. I'm sorry, did anybody else have anything coming up that they would like to share? I should have said that first. Okay. All right. So our question for our providers, Dr. Peace, Dr. Johnson, and Shadira. If you could choose, what would you rather do? Catch a baby at 8 a.m. or 2 a.m.?
You know my answer. I have the karma of the 3 a.m. babies.
She definitely. I would say 8 a.m. You don't really matter to me.
I would say I got out of that game. I can catch a baby in a pinch. Yes, I can. I can deliver a baby in a pinch, but we're gonna call that 911. I'll see about controlling that head, and we're gonna but neither time.
Oh God.
And
Okay.
that is excellent self-care from a therapist. You have to know your limitations. That's not your season right now. I love that for you. I love that for you.
Oh goodness. Yes, Dr. Peace is really good for I'll be right back. I'm going to get something. I'm going to do something in at 3 a.m. That baby be like, I hope you downstairs. And she has to come back up and get that baby. For my therapist, I got questions for everybody. Would you prefer a nature event or a yoga relaxation event? Which one? More active outdoorsy or indoors, kind of a controlled environment, relaxation?
Indoors. I am not an outdoors girly at all, but it is good to get some sun and all that. But if I had to pick, I'm picking something inside for sure.
Okay. For 9, let me just find my question again. I know neither one is good for your teeth, but would you recommend candy or cupcake?
In moderation, both are fine. However, the oral hygiene routine at home, brushing, flossing, rinsing with a fluoride mouthwash, better be almost amazing. Now, I say, like for Halloween, like those holidays where you're constantly eating candy, eat it all in one sitting as opposed to day by day by day by day. Exposure to sugar over a long period of time, development of cavity. So if you're gonna have that candy, eat it all in one sitting, not a lot. Eat it all in one sitting, brush your teeth, floss your teeth, rinse your mouth, go and see the dentist afterwards, as opposed to literally having it every single day of the month. So that'll be my little tidbit.
Okay.
Mhm.
How are you
I
going to
think
eat all
my
that
children
candy?
love eating it all at one time. They would love that.
Even better.
I don't know how I couldn't do all of that. I'll be bouncing off the walls.
I
Everything.
know.
Oh,
We say the same though for like sippy cups. So if you're gonna have juice or something in a sippy cup, first of all, dilute it with water, and we don't want to be having it 15 times throughout the day. Have it in one sitting, take it away. Eventually wean your way off to water. But again, that prolonged exposure to sugar on tooth structure is immediate cause for a cavity if the oral hygiene routine isn't great. So we always say have it right then and there and then be done with it.
Okay. A question for everyone.
I actually I actually have a question, dental question, because it's the bane of my existence with
Okay.
my children.
Okay.
Dentists always tell you no gummies, gummy vitamins or whatever, but all the vitamins, whole food vitamins, everything that's for children, always in gummies.
Hmm. I mean, I think they're saying no gummies just because of the groovy parts of the teeth. If all of that stickiness gets stuck in those grooves way in the back, it's harder to brush like those molars. But if you do have gummies, you better just make sure that the oral hygiene routine is good. I can't tell a mom or I can't tell any parent, okay, today, no more candy, no more chips, no more goldfish, no more soda, no more pasta. Pasta is a carbohydrate, breaks down into a sugar, but in moderation, everything is okay. But you need to be going to see the dentist and you need to be brushing your teeth. I can never say to a parent, cold turkey, you need to stop doing these things, especially if it's just a part of your routine, even cultural things that we eat, right? But just make sure that you are seeing the dentist, you're prioritizing the dentist, you're doing what you need to do at home, and then ultimately just making sure that your oral hygiene is good. So,
And please brush your teeth twice a day minimum. We have a lot of kids that I counsel when they're in their well child, and like
Uh-oh, Dr. Johnson, you muted yourself.
and they may say I brush once a day or I skip this or that. And I'm like, please brush your teeth more than once a day and
Yep.
not have that food sitting in your mouth all night long. Yeah.
Yep. I mean, that even starts before teeth come in. How you take care of your oral hygiene as an infant, well, mom taking care of it, wiping the gums, wiping the teeth, any prolonged exposure, breast milk, one of the biggest causes of cavities in young infants because it contains sugar. You would never think like, okay, it's natural, it's coming from my body. That's going to be cause for a cavity. Breast milk contains sugar, whether you're buying it from the store, milk, whether you're getting it in formula or whether it's coming from your body, sugar is sugar. So if you have that sitting on your teeth, sitting on the gums, potential cause for a cavity. That's why we say it literally starts in the infancy stages. We highly recommend breastfeeding because we know all of the benefits. We know every mom is different. However, if you're breastfeeding, try not to do it before they're going to sleep. And if you do, go in and just wipe the gums off, wipe the one tooth that is there, brush it off really quick. I know they might be sleeping, I know they might fuss. However, you should see the amount of kids that come into our offices, Bloomfield, Newark, and Trenton, and this is a nationwide issue. Even if we weren't talking about New Jersey, kids have cavities which are preventable. I said at the beginning, if you have access to a dentist and you're doing what you need to do and you're educated on the importance of oral hygiene, coming in 20 kids, 20 teeth, full set, ideally, right? Cavities on every single one of them. And at those young ages where the teeth are still developing, how you take care of your baby teeth literally gives rise to your adult teeth. If we have to prematurely extract teeth and do fillings, let's say we took out 8 teeth from a child that's not even 4 years old, those adult teeth are not coming in until years after. What do you think that'll lead to? Speech issues, developmental issues, mental health issues. Kids are cruel, not being able to articulate themselves, to share with their parents how they're feeling, being held back in school because they can't speak properly, right? There are so many things to your oral health that you just don't think about. It's more than just about a pretty white smile. It's literally the gateway to your entire health. Mentally, physically, developmentally, every single part of it. We have to talk about oral health more. We can't be scared of the dentist anymore. We have to prioritize it just as we go to the OBGYN, just as we go to the pediatrician, just as we go to the ophthalmologist, anybody, dentist has to be on the same level. So I'll stop right there.
Awesome, awesome, awesome. All right, a couple more questions. If in between your shifts, in between your day, are you napping or are you snacking? Everybody. Anybody.
You know, I'm
Napping.
Yeah, I'm sleeping.
Napping.
Napping.
Dr. Johnson?
Oh, I think I was the first to jump in, or at least I thought I was. I said napping. I'm going.
Oh. we all agree that the close your eyes for at least 5-10 minutes. Awesome. Coffee or tea?
Tea
Tea.
person.
Tea.
I'm on the mushroom coffee thing right now. So I'm gonna say coffee.
I'm on coffee. Coffee.
How
I'm
is that,
doing both.
Doctor? Both. How is that, Dr. Pease?
Actually, I love it. My digestion is better. I have a little bit more energy. I don't have, the bloating and everything. So I've cut out regular coffee altogether.
Oh, okay. Does it come in like the Keurigs, or you just like get the bag of it?
I'm using the one Rise right now. I tried that one and Daily Dose. Daily Dose is okay, but I think the Rise seems to be a little bit better.
Okay. And last rapid fire question. While you're working, do you want music or no music?
No music.
I need silence. Music.
Music.
Music while I'm in my office.
9.
If I'm in a treatment room, music, if it's a good patient.
Erica, Danica?
I would normally say music, but I don't know. Something happened once this menopause started kicking in. I just want peace. I
I'm
used to
definitely
have a WBLS on or something, but now I need to be quiet. The work.
music, definitely.
Music.
Hmm.
It depends on the day. I can say that. It definitely depends on the day whether I need music or no music. Sometimes a good playlist is all right. And then after a while you just like, okay, cut off. You're doing too much. It's too much stimulation. You get overstimulated after a while. All right. So back to our questions. We have a little more time to go. So let's start off with let's see. Okay, Barbara. How can partners, we're going to try to talk about support now. So, how can partners and family members be a part of the mental health support system during pregnancy, postpartum, all of that?
That is a great question. And I think the number one way is to really just check in, just be helpful. Whatever you can do to make it easier for mom without making her have to do the mental labor of telling you what to do, just do that. So if a mom is breastfeeding or nursing, you're washing the bottles, you're changing the diapers, you're, checking in, did mom eat today? Does she need to get a walk or some fresh air? Has she connected with her friends? Whatever you can do to be supportive without necessarily, what do you need? How can I help you with this? People mean well when they say those things, but sometimes we don't know. We just need you to help with something, folding the laundry, doing the laundry, and also just communicating and keeping an eye on things. And so I think that is one part. And the other part, again, that I try to work with moms on, if I get moms during pregnancy, we kind of do like a pre-pregnancy plan. But, if you know your person, you got to have a bag of things that you might need that might be helpful. And those things may change over time. But again, you want to think, how can I make life easier? How can I make her not have to think about something or take something off of her? Make sure she's getting sleep. It's, newborns, they sleep weird. And I think that we need to make sure that mom is getting her rest, that the new parents are getting rest. And so I think whatever you can do to make life easier, to connect them with, support, laugh, have fun. This is a crazy time. It's a new time. Everybody's adjusting. And so I think those would be my number one things. And the other thing I would add is, just pay attention to, things that might be really triggering. Maybe the birth of the baby may bring up the grief or the loss of a parent or someone else that they're close to that's not here to experience this time with them. And so just really checking in. And again, like I said, I just think paying attention to the mom. We see, the baby's here, we're excited about the baby, but the mom just delivered the baby. So we want to make sure, did you go to your postpartum checkup? Do you have an appointment with your therapist? Just asking and checking in, I think would be my number 1 and 2 things.
Absolutely. Absolutely. Dr. P, same question. How do you encourage the support of partners or family members that might come into the visits and for the pregnancy and postpartum period?
Well, usually they come in with the father of the baby. And my first visit is I give them 3 jobs. I told dad, you got 3 jobs and that's it. Whatever she says, whatever she does, no matter how crazy you think it may be, your answer is yes, dear. That's it. And your look on your face cannot say anything else. You do whatever. She says her feet hurt, you rub her feet. Anything like that. If it's an appointment, be there for the appointments. And make sure of all things, a nice push gift, showing that you appreciate all that she had to go through to get to that point.
Absolutely. Absolutely. And Shadira, same question.
I second that. Honestly, whoever comes into the room, whether it's the father, birthing partner, or like a mom, a sister, just making sure that they know that they're equally in this pregnancy and process as the person giving birth, and just allowing them to know that whatever they need, they're there for them. I find that a lot of women don't know how to ask for help or don't want to, because you're supposed to be seen as superwoman. Pregnancy is supposed to be beautiful, it's supposed to be one of the most important things in your life, and moms often don't want to be seen as having an issue or not enjoying their pregnancy, which is often some things that moms go through that they don't speak about. So having someone in your corner that can kind of help you talk through things or just be there as a listening ear is always important to kind of guide you through your pregnancy.
Okay, awesome. And Dr. Johnson, how do you, when someone comes in to say like, hey, I'm looking to expect, how do you kind of get them prepared or, understanding their support system and how important it is?
Yeah, so one, it is important to know who's on the patient's team and who's available, who has questions. We invite families to come in if they want to have a family discussion about it. We've seen partners together, or people who are trying to work on family planning, and everyone has questions, so we just bring everybody into the room and we can sort of answer the questions for both the patient and the family. In some instances, and I think someone mentioned this too, it's addressing certain traumas that may be present. Some parents have history of miscarriage and other things, and we have to evaluate that stuff. Like if there's a long history of that, we have to sort of go into looking into see if there's autoimmune disease or something else if it hasn't been done. I also recommend that patients are really aware of what their issues are. If you were on a medication, what was the name of the medication? If you saw a doctor for something, what was the name of the condition? Like just kind of know your own medical history. You might be seeing, an outpatient clinician. Most of the clinicians in this area are hospital based or employed. Many of them, but many of the obstetricians are still, they might have their own offices, their own sort of internal system for their medical records, et cetera. And I encourage them to, get your records, like make sure that we have that information, because something might have happened postpartum and you were tired, you weren't as aware of what was going on, and say, oh, I had a little bit of bleeding, and then we find out, you had all these transfusions and other things that, we need to sort of evaluate and follow up on. Or maybe you had a complicated episiotomy and now you're having vaginal issues, and we need to kind of know that. So I encourage people to know their history as much as possible. And the things I mentioned previously about just sort of looking at yourself sort of holistically in sort of preparing to plan your family. I am not going to repeat those things, but just sort of a holistic look at the person and their network, and trying to just provide as much support as we can.
Awesome.
And good information. Sorry, that was the last thing. So many people are going online and looking at somebody's auntie's cousin's friend's site, and then they're saying, oh, I need to do that. That person did that, so that's what I need to do. You are you. you come with your own genetics, you came from your parents, you have your own family history. We use evidence-based guidelines, meaning we look at whole population studies, et cetera. And so there are some things that, you know, Sister Mystic is doing that you cannot do or would not be healthy for you to do, either in preparing for family planning during your pregnancy or even after. And so it's super important that part of our role is to guide you towards good resources for information. And you can ask us all of your questions. There's no silly questions to us. I want you to have the information that you need. So that's the other big point I wanted to make about the information, where you're getting it from. Can I add one thing to that too? In knowing your health history, I also encourage the moms to be very aware of things like their iron levels, their vitamin D levels. Put a note in your phone, know that MyChart information, because those types of deficiencies also can mimic depressive and anxiety symptoms as well in moms. And so we really want to have that holistic picture, because you may be feeling like you're going crazy and you may also just be anemic and not paying attention to that too. So I just wanted to make a plug for that. In the holistic picture of things you need to know, like, you should know those numbers and what they mean for you.
Absolutely. Shameless plug. This is why I created this book. I don't know if you can see it. Wait, let's go. Wait, okay. There we go. Oh, wait, I lost it again. I'll see if I can. I don't know how I'm going to do this, but I had to put it in the chat or something. But it's called More Than a Mother, a journal to keep it all together. And in my journal, I created, because of exactly what you were saying, just knowing your information. And oh my gosh, what was my blood levels? What was my blood? This all that. This journal will allow you to keep all that information in one place, so that when you go to your doctor's appointment, you have something to say, oh yeah, I can open this book up and put it in here. Or if the doctor is telling you something from one doctor to the next, you can just go from one doctor to the other, versus having to, oh, let me get this receipt, or I think I put it in my phone, or I think I put it here. It's all in one place to keep everything together, from the mom to the baby. So it's called More Than a Mother, a journal to keep it all together. And it is available on Amazon. I love my book. All right, back to the regular schedule program. So, Dr. P, when should someone consider seeing an OBGYN versus a midwife?
That is such a loaded question. I think there's pros and cons for both. So and Jadira, you can chime in anytime for this. Midwives do more of a holistic approach. You probably get more of a personalized care versus a medical office as far as being taken care of. However, midwives mostly do low risk pregnancies. I mean, they have a OBGYN as a backup, so they can help with managing high risk, but it's pretty much low risk. So if you have any kind of high risk issues, it may be better to go to a physician. The other thing is you're less likely to have interventions with a midwife versus a physician. The physician is about get the baby delivered safely. So we're utilizing Pitocin, we're utilizing rupture of membranes, epidurals, and looking at the baby's strip. We're less likely to sit on a strip that's questionable as far as how well the baby is doing. As far as GYNs, like I said, we're more equipped for high-risk pregnancies. We also are equipped to do surgical intervention if needed. We handle a wider range of complications that happens either before the pregnancy, during the pregnancy, or after the pregnancy. And we pretty much just work at the hospitals. Midwives can do hospitals, birthing centers, they do home deliveries, things of that nature. But if you're leaning towards a more natural birth with less medications, midwives are the way to go.
Okay, what are some
I don't know if I supported myself in that whole discussion, but we do handle most of the high risk stuff. And it's also physician dependent. We have some doctors that work more like midwives, so you'll get some of that experience of a midwife versus a physician. Then you have what you're comfortable with, because some doctors you can just have conversations like it's one of your girlfriends, and you don't feel like it's a big difference between the two. They're not talking over you with the medical jargon. So it's really dependent on who you come in contact with.
Okay, but what are some high risks? Like what would you consider high risk?
Um, Patients with, previous C-sections, preeclampsia, uh, diabetic patients, patients that have what they call polyhydramnios or oligohydramnios, too much fluid or too little fluid around the baby, growth discrepancies with the babies. If they've had previous pelvic surgery like myomectomies, things of that nature that something can change very quickly. So you want to have someone there to be able to handle that right away. And which is why physicians stay in the hospital setting, because if we need to change the plan immediately, everyone is already there.
Okay, thank you.
We used to say advanced maternal age was high risk, but everybody's advanced maternal age these days, so I don't really consider that a high risk issue anymore.
Okay. And Shadira, piggybacking off of that, when would you, as a midwife, collaborate with an OB?
To me, I'm always collaborating with an OB. Although we work with low risk pregnancies, a lot can change with birth and it can happen very fast. So I feel like it's always important to have that rapport with the high risk physician. Dr. Peace will let you know I'm no stranger to asking her for advice or a question on how a labor process is currently going and what she would think, should be the next step. And I just feel like it's important and a blessing to have both. You have kind of like the best of both worlds. I mean, just because an OB deals with high risk doesn't mean they can't be personable to your care and taking that into heed, but also with midwives, just because we're more on the low risk holistic side doesn't mean that we don't know when it's time to make a change in the plan. So just making sure that the health of the baby and the mom are the priority, but also helping the patient navigate, informed choice and autonomy all together kind of helps make that plan for everyone.
Okay. And a piggyback off of that question for you, who would you consider a good candidate for like a birth center or a home birth?
Birth center, there's no perfect patient. However, not having any comorbidities, I'm a very big fan of family planning. I don't have very many patients who come in before they're planning a pregnancy, trying to kind of get their health in a row, not only them, but their partner, because it does take two. A lot of things that happen with your partner can affect your pregnancy. So if you're both not equally, up to par with your health, then things can change throughout the birth process. But just having you making sure, like someone said, making sure your iron levels are good, making sure you're eating a healthy, balanced diet, what that looks like, whether you're, someone of the diaspora or other people, we eat different things culturally, but it's still healthy. You don't want, a provider to tell you that you can't eat something just because they don't deem it healthy, when we all have different aspects of our culture that can give us the nutrients that we need in our diet to make sure our pregnancy progresses how it should. But, someone who is eating healthy, making sure that their labs, whatever that may seem, are where they need to be. I don't really characterize BMI, especially as Black women. So it really doesn't matter if you're the tiniest or the largest. Healthy is healthy. So in that aspect, you can be a candidate for a birth center or home birth. But when we start to get into the things of blood pressure issues, that's a no-no. Diabetes, when you're dealing with medication, when that's involved versus when it's diet controlled, you can still deliver in a birth center. But when you're starting to deal with insulin and metformin, then those are things that we or I would recommend that you're in a hospital. Like Dr. P said, it's important to be close to the things you need in case things do change. And I think in this day and age, a lot of people are very into the midwifery and holistic, and I want my birth how I want it, which is very important, and I don't take that away from anyone. But it's also important to utilize the things we do have in modern medicine, because they're there for a reason. There are a lot of women who aren't here today because they didn't have that, and we have that now. So it's not, taboo to use if needed. And you can also have the birth you want, hands off and everything, depending on the provider you have to advocate for you, even in the hospital, if that does change from home birth center to the latter.
Absolutely. Thank you. And Barbara, piggybacking off of Shadira's question, what she stated, how do you support patients, or how do you recommend patients advocate for themselves in regards to the birth that they're looking for, or things of that nature?
Yeah, this is a great question. I tend to partner with the doctors from the background. I probably need to get more from the front, but I know who the Black ones and the ones that my moms love are, and I tend to try to connect them with them. But I also try to get them to be very honest with themselves. If I have a client that is very anxious, I'm gonna need her to go to Dr. Peace and be where all the things are should something happen. And so I really just talk to them about, like, we all have our vision of what we would like our birthing experience to be, but also, like everyone is saying, I want you to be where you're going to be able to be best for your mental health as well. And those things can change over time, but really just, again, not associating having to not use a midwife in a particular way, not as a failure, right? There are a lot of awesome doctors. That's why we have them. There are a lot of awesome things in different settings that work for different people, and we want the mom and the baby to be healthy. That is the ultimate goal. And so I think my work on the mental health side is getting people okay with that and accepting that whatever decision they need to make with whoever their providers are is something that works for them. How do you feel when you're asking questions with a particular doctor? Have you had things that have made you uncomfortable that you might not feel like when you're under a lot of stress and delivering a baby that this person is the best person for you? And so for me, it's just really, getting moms to a place where they can advocate for themselves and not feel, disappointed or manage their disappointment if things don't go a particular way. Because again, we don't want someone who's already tends to have a more anxious personality or is already experiencing a lot of anxiety to throw themselves into another anxiety provoking situation. And on the other side, on the depressive side, like, if you're already prone to depression or already experiencing depression, if things don't go the way that you want, what is the best option and the best care team for you? So that way we can, help you manage those symptoms and so you and your baby can be safe.
Absolutely, absolutely. And Dr. Johnson, when someone comes to you and you already know they have comorbidities and they're seeking pregnancy, or they find out that they're pregnant, how do you help them with what they're going, what their health is right now, to make sure that they can carry and go through a safe pregnancy?
So again, starting with being aware of the medical history and counseling the patient on how those particular medical issues may impact a pregnancy. I tell them, start taking that prenatal vitamin, when you're thinking of having or starting a family. We also tend to, we sort of tend to discuss with our patients the importance of, I keep returning to this whole thing about the relationships and support, because I think often it sounds like a strange thing to focus on, but a lot of the patients with whom we interact really have a need for more support in their lives, and reaching out to friends or other family members. I ask them if they have family nearby, do they have a friend group or circle or something like that, who is their support, and that they could be developing that or finding a friend group. We talk about potential complications that may arise. And so the same things about eclampsia, preeclampsia, we talk about that. And I tell them this is what you need to look out for, especially during that first trimester. And sometimes either in the emergency room or in our office, we're the first person to tell the patient, oh, you're pregnant. That might be the first time they're hearing it. We also don't judge, and we sort of destigmatize that question. They may not be that excited. They may have stuff going on that they need to sort of think about and make a decision about. So I just kind of say, this is what the test result is, and what are you thinking? How are you feeling about that? And letting them sort of, express what their decision making is and what they're thinking about. So those are some of the sort of things that I don't know if they've been mentioned yet. I was trying to think of things that haven't been mentioned just yet. Those are some of the things we discuss. Postpartum, we also talk about preeclampsia and postpartum complications. So they may not know that you can still have issues with your blood pressure, blood sugars, et cetera, even up to a year after delivery. And so we need to be on the lookout for this, or that symptom. So just sort of some of the things haven't been mentioned, but those are the things some of the things we talk about.
Can I add one too about the support? That is a big one. We are living in a time where people are more connected and still isolated. And that has a huge impact on the mental health of mothers from pregnancy to whatever. And so I would also add encouraging moms to find online groups if they don't have family. Like I feel like families are not as nuclear as they used to be, or relationships are in a different space. And so they may need a new mom community. We do run a once a month mom mental health support group on the first Thursday of every month, with the parent in partnership with the Perinatal Health Equity Initiative in East Orange. They just have to live in New Jersey. They're more than welcome to come. But groups like that, there's Facebook groups, there's like the Moms Group of New Jersey, there's a whole bunch of different things. But I think that we are living in a time and space where people are very isolated, and moms need community and support, especially when they don't have those families and friend groups there. So I think that is one thing that I just want to throw out there too.
Okay. Luciana, I do see that you have a question. If you could put it in the chat, because we're going to have a Q&A period in a minute. And so then we'll ask your question, okay? I do see your hand. Naila, I want to ask you very quickly, is it safe for cleanings and x-rays or procedures during pregnancy? And when is the best time?
Yes, so it's entirely safe according to the American Dental Association and the American College of Obstetrics and Gynecology. They together recommend that every pregnant woman needs to be seeing the dentist. It's entirely safe to get teeth cleanings, to get your x-rays, to do fillings, extractions, all of that stuff is safe. Now, as dental providers and dental educators, we take different precautions. Let's say for x-rays, we do 2 lead aprons, although the ADA is now recommending that you don't even need that covering because the radiation level is so low. However, at KinderSmile, we are still aproning up. And even just to give you a little bit more like perspective, it would take 50,000 pictures of 0.0001 radiation for there to be any fetal effect during pregnancy. We don't even take 50,000 pictures within a lifetime. You are once a year at most getting 6 pictures for an adult. Upper, lower, 2, top, bottom, 2. Yeah, top, bottom, right and left. Sorry, thinking of all quadrants of the mouth. But it's entirely safe to be getting these procedures. We use different anesthetic as well. And at KinderSmile Foundation, we require our moms after education to get a dental clearance form from their OBGYN. So you guys were just talking about support. We are not only just seeing, dental patients and making sure they get their care, but we also partner with many different organizations within the community to make sure that, yes, we're providing the oral health care, but we also can refer you to see a therapist. We can refer you to see an OBGYN, to get your midwife, to get your family medicine doctor. We're not just covering oral health care, but like I said at the beginning of this call, oral health is the gateway to overall health. So once we address this part up here, we can refer you off to make sure that you are good holistically. Also, another little, not fun fact, a little sobering, but 80% of OBGYNs do not cover dental care in their prenatal visits. They do not routinely refer to dental offices. And like I said, dental medicine completely separate for most people. However, we need to start integrating the two because we see the effects of not going to the dentist manifest on the rest of the body. So it takes 30 seconds, all my providers in here, not even 30 seconds to ask 5 questions. When was the last time you saw a dentist? Are you currently experiencing any dental pain? Did you know that poor oral health or periodontal disease can lead to preterm birth, low birth weight, preeclampsia, gestational diabetes? That takes less than 15 seconds to ask. And right there, if they answered no to any of those questions, immediate referral to a dental office. Find a provider that is willing to see them, to see pregnant patients, is comfortable, and make sure that they get the care, because we see the effects of a lack of dental care on not only mom but on the developing baby, and that's going to affect generations to come. So I cannot emphasize enough how important dental care is, and just making sure that we're working together, medical, dental, whatever you are, we are integrating all of these services into one for our pregnant and postpartum moms.
Thank
But yeah,
you so
that
much.
answered your question and then some, Kira.
Yes, it did. And that's why we are here, to figure out who do we need on our team. Because evidently we need everyone. We need all of us to be on the same team, working together for the same cause. Because if something happens orally, it's going to affect the baby on the back end. So, and then it's going to affect the mental health. So everything is coinciding and working together. So yes, thank you for that answer. I really
And if I
appreciate
can add too, we talked
it.
about preeclampsia. I think Dr. Peace was talking about preeclampsia a little bit, but we know there's a direct relationship between gingivitis, progressed periodontal disease, and preeclampsia. That's the #1 cause of why Black women are dying. So how can we not talk about oral health and dental care when we know that it's directly impacting our Black moms who are dying at a disproportionately high rate than any other race or ethnicity in this country? We have to start talking about dental care, oral health care. It's so, so, so important. So I just wanted to add that too. Okay.
Thank you so much.
Yeah.
Absolutely. And that's how Take Care of You came about, because doing research and finding out that why in the state of New Jersey are we 11th where maternal mortality, which was just like, how is that possible? Where it's safer to deliver in a third world country, in some third world countries, than it is to in the United States, which is such a progressive country, supposedly. But that's why we have these conversations. That's why all of these businesses, organizations, and most majority of why we are here and what we do, and why we're so passionate about it. Getting towards the end of our conversation, we want to talk about postpartum. And I want to start with Barbara. How can you differentiate between the baby blues and postpartum depression? And what should you do if you recognize it, even if you're not the mom, if you're a support person?
Yeah, and the main difference is the length of time you experience it. And it's so baby blues, I think I mentioned before, it's just like a few weeks, maybe like the first month or so, really just a couple of weeks after you have your baby. Postpartum depression will be more persistent. The symptoms will be more intense and they will last longer. So it could be from a month to a year, I would even say multiple years after delivering a baby. And again, particularly in Black women, it is just this pervasive sadness. Your pervasive sadness and kind of like depressive state. You're going through the motions, but you're not like quite there. And so again, what I mentioned, I just want to go back, so I want to make sure I don't forget some of the important points. You want to look for the mom that might be a little bit more angry or irritable. She has an attitude. That's what you want to look for. Because ask her, what happened today? Did you eat today? The tendency with Black women, they're not often met with care. It's just like, what's wrong with you? And so if you're noticing someone is a little more snippy, a little bit more irritable, that's something you want to look for if you're a friend or a family member. Overperforming, we do that a lot. Like I said, they may be going to the activities, doing all the things for everyone else, but not themselves. And so you want to look for that. Stress eating, they may just say, I just don't feel like myself. Those are things that we want to look for in Black women in particular. This may sound a little odd, but is their hair done? Are they dressing how they normally dress? These are important self-care things for Black women in particular that we want to look out for. And again, approaching it in a non-judgmental way. Hey, do you want to go get your hair done? Do you want to go get your nails done? Do you want to get outside? I'm noticing, you're wearing all black lately, and normally you have that pop of color in there. These are very important conversations to have. And again, it can be disguised as, I don't want to minimize this enough, anger. They're just mad at everyone. We want to really pay attention to those things. And so those are things we want to look at. One thing I do want to mention too, even if, I know everybody is doing their own holistic things, but when you are experiencing depression, like clinical depression, I always talk to my clients about, you might need some extra support. Psychiatrists get a bad rap. I know a lot of really good Black psychiatric nurse practitioners, but medication may need to be a part of that, especially if you're doing assessments like the Edinburgh. If you get a Black woman that scores pretty high on that, because we tend to not tell the truth sometimes, that is already a red flag. And so I like to describe to my moms is, sometimes you got to put the umbrella up. Like if it's raining outside, you could walk in the rain and get home, but you don't want to mess up your hair. You don't want to be soaking wet. So sometimes you might need medication that is perfectly safe. You can talk to your family doctor, you can talk to your psychiatrist, you can talk to a psychiatric nurse practitioner about what might work for you, whether you're pregnant or postpartum, because there are lots of things that are really safe during pregnancy, because you could get where you're going to go. It's just going to be harder. And sometimes we don't like to take the quote unquote easier route, but everybody needs help. And so I think that that's a conversation that we need to have more often sometimes, because we get to the point where it's so bad, and it doesn't have to be this way. I wouldn't necessarily say it's preventable, but it is manageable, and we don't always have to just work through the pain, because it just makes it harder. And sometimes, medication management can be the difference of you showing up in the world and in your relationships how you want to be, versus you just showing up with all this like stuff and you're there but not really present. And so I think those are things that I would encourage you all to look for, conversations to have. And like I said, some things get a bad rap sometimes, but we don't always have to take the hard route for everything. So that's my spiel on it.
Awesome. Thank you. Dr. Johnson, when should someone see their primary care doctor after delivery?
So we call the 12 weeks colloquially after delivery the fourth trimester. And so generally, if it was an uncomplicated pregnancy, there were no other issues, the ones we've mentioned so far, we're usually seeing them within 12 weeks of delivery, because they're still seeing their obstetrician for follow-up visits and their pediatrician for visits with the newborn. But sometimes we need to see you more than that. Or sooner, because it depends on what happened over the course of that pregnancy. Again, I mentioned wounds, I mentioned diabetes, I mentioned blood pressure issues, I mentioned depression. We've been talking about mood-related disorders. And so I may be seeing them sooner than that sort of 12-week mark. They may have to come within 2 weeks or less. We also see infants, so I might be seeing them as a part of their new baby exam. And so I'm also evaluating and asking mom or asking the parent questions about how they're doing and how the family's doing with the new baby. So it really just kind of, again, depends on the course, but definitely at minimum by that 12-week mark. We want you to come in. If you can come in earlier too, we're not going to turn you away. And the other thing I forgot to mention that wasn't mentioned before, the other reason you're seeing a primary care doctor is because we handle all the other things. So yes, your obstetrician is going to be checking for urinary tract infections and that kind of thing. But if you develop a respiratory infection, if you develop diarrhea for some odd reason or some other things, like you can call them and they will certainly help to provide some guidance. But at the end of the day, most of the time they're like, go talk to your primary. Waist down, we got you, or abdomen down, we got you, or your breast down, we got you. But like the other things that you have going on, they may not be able to navigate that or need to navigate that, plug in with us for those things too. So you may, after delivery, have to, you may have a urinary tract infection. You may have questions about your sexual activity, and maybe you're experiencing some issues with re-engaging with your partner after delivery. It could be in the short term once you're cleared, or the long term, some people years, where they're having relationship issues or issues with having sex with their partner. So we're here for all of that. So minimum 12 weeks, maybe sooner, and definitely beyond that point as well.
Okay. Dr. Peace. So after you said congratulations, here's your baby, when is the next time you are seeing your patient?
If they've had a C-section, we usually see them 1 to 2 weeks to check the incision. And then we have the postpartum visit, which is at 6 weeks. And depending on what's going on, they may have additional appointments.
Okay. And so when do you kind of discharge them from that your services?
I'm going to tell you, most of my patients don't leave. they, they try to use me as their primary care as well. But in general, it's probably between that 8 and 12 week mark.
Okay. Okay. Thank you. And Shadira, what are you suggesting far as postpartum support, like if from a birthing center's perspective? If they come to the birthing center or they do a home delivery, when are you, or what are the services that are provided with those type of settings for delivery or when they need to go to do a postpartum visit?
Those more so emphasizes continuity of care. It's very personalized per mom and their family's needs. So home births, of course, you have home birth midwives who go to the house. They're checking not only mom and baby, but scenario environment wise, seeing how things are taken care of in that aspect to kind of help gauge and bridge the gap in that sense. With the birth center, we offer to see the mom within a week of delivery, and that's just to make sure they're doing okay. How has the last week of welcoming a baby in this world been mentally, physically, or any other aspects that they're going through? And then it's kind of like a case by case basis. Usually standard time would be 6 to 12 weeks, but we often see that we're continuously seeing our moms after that, just on a basis of what their needs are, whether it's encouraging them to kind of process their birth experience, because a lot of women deal with trauma in that instance, which kind of trickles down in other aspects in their postpartum journey. And they can't kind of, focus on taking care of their baby because in their mind, they don't want anyone else helping them, because in their mind, they feel like someone's going to harm their baby or take their baby. And that kind of decreases the self-care of the mom, because if you're always taking care of the baby, you're not closing your eyes, you're not, you don't want anyone else helping. How are you helping yourself? So when we kind of delve into that and kind of monitor and talk it through, we're able to process and help them in other aspects.
Awesome. Thank you so much. Thank you, ladies, so much for coming on today. I really appreciate it. I want to allow you to share your last words, comments, or anything that you would like to share. We're going to start with Nye. We're going to start with you.
I would say it all starts with mom. Mom is the one who really says what goes in the household. Mom is the one that gives birth to a child. Mom's health is indicative of the baby's health. Take care of your oral health. Prioritize your oral health as mom. That way you can be a leader and set the tone for the entire household. That's going to impact generations to come. Consider oral health just as important as any other type of medical profession. It's literally the gateway to the rest of your body. Children have died, unfortunately, from not getting timely dental care. One of the reasons why KinderSmile Foundation was started, and not to make it a sad thing, but there is no reason ever why any child, any adult, any human should have to die from something that is preventable. Educate yourself, advocate for yourself, speak up, and just make sure that you can get the care that you need to take care of your entire body.
Awesome. Thank you. Next, Shadira, last words or comments?
I really enjoyed this conversation. I feel like it's very much so needed. And I just appreciate each and every one of you in the aspects that you bring to the birth community, especially for women who look like us. I feel like this needs to be an ongoing series, because I find that a lot of patients that I've worked with don't have this kind of support. And I'm glad that I've connected with all of you so that I can remember to refer my patients when the time is needed. So yeah, thank you.
Dr. Johnson, next.
So I just want you to remember that your medical team, including your behavioral health care, that's my dog, sorry, and your primary care doctor, your obstetrician, we're on your team. The things we're going to recommend for you are things that really are recommended to get you to your best health. And, we want you to be honest with us about where you are, what things are going on with you so that we can help you to the best of our ability. And we want you to know that we also coordinate with each other. So, if you have questions, concerns, issues about other things that are going on, just come to us. We can help you answer those questions. So just know that we have your best health in mind. I don't get paid anything extra by any company or any other company. No medications. If I'm recommending them, I don't get paid anything extra. If I'm recommending it for you, it's because I think that that's going to help you get towards your best health. Or if I'm saying, I don't think you need this medication anymore, it's because I think it's going to sort of help you towards your best health. So find a medical team that is supportive in that way, that is willing to work with you and also sort of work with what's going on with you in an honest and respectful way. And that's one of the best ways that you can have a healthy pregnancy.
Awesome. And Dr. Peace?
Well, first I want to mention with the home health care, I believe the state of New Jersey is in a process of setting up nurses to visit every delivery at home. I don't think they got to Essex County yet, but I know that's in the process. They're starting with small cohorts and finding funding for it, apparently. But as far as your medical care, two things you have to do. One is shop around to decide whether you want natural birth versus hospital birth. And you need to shop around to what type of provider you want. When you meet them, you have to see if it just feels good in your spirit that they work with you. Because sometimes you can have an excellent doctor, but there's no vibe there, and you're not going to feel comfortable talking to them or expressing what's going on with you. Second thing is be honest with your physician as to what you want at the beginning of their pregnancy. I see quite often patients that come to me because they heard I was good. And then, 3 weeks before they deliver, they come up with a birth plan that's not realistic for a hospital. And then they're upset. And that's why you bring it to the beginning. So if what you want and what I can give you does not work, then you have to decide, do you want to keep those things and find another physician, or you want to be flexible? So you have to be honest with your provider as to what you expect with your pregnancy. So if you have the right person. So those are the big takeaways, and advocate for yourself. Don't let, calling the hospital, going to the ER, and they telling you something that just doesn't seem right to you. Check it out, advocate for yourself, because no one's going to advocate better for yourself than yourself.
Absolutely.
That's my 2 cents.
And it was a very healthy 2 cents. And Danica just put in the chat that the New Jersey Family Consortium, as well as New Jersey Family Connects, does offer, I think it's 2 home visits after delivery for any mom within the state of New Jersey. So I know that is something, but they're looking to extend that out. But they do have a service, and they don't turn any mom away, regardless of insurance or no insurance. So Family Connects New Jersey is the source that supports that home visit from a nurse afterwards, and they look after the baby as well as the mom also. So, and then they kind of support you from there if you need additional services. And Barbara, if you can bring us home.
I really just want to say that, I really want, my wish for all Black mothers is for us to, get to a space where we're not just surviving, but we're thriving. And I think there are enough resources and supports out there, if you can get your team right, to help you get to that place for your mental health and your physical health. I think Dr. Johnson mentioned this early, everything on the internet isn't true. There's a lot of pop psychology out there. There's a lot of different things, but like our mental health is really important, and everything you need to learn is not on TikTok or on Instagram. And so I think that find a provider that you can be honest with and that you have a good relationship with in all the different buckets, because if your mental health is good, you'll be able to take care of yourself, your babies, and everybody else. But our mental health matters too, and we don't have to do everything from a place of survival. And it is just hard. Like, life is hard, but there are a lot of things in place that you can learn, a lot of support. If you have the right people, you'll feel so much better. And so take care of your mental health as much as your physical health. If you feel like you can't talk to your doctor about something, or you feel like you got to lie, you might need a therapist to help you work through that. You know, if you're grieving, if things are just feeling away, or even if things are feeling okay, like, you know, we have doctors and we have accountants and we have different things when things are all right. Like, you don't have to come to therapy when you're all laid out at the bottom of the bed somewhere, you know. So just take care of yourself. We can get through pregnancy and motherhood from a place of thriving and from a place of rest, and not from a place of just we're just burnt out at on both ends, you know. So that would be my story.
Thank you. And this is why Take Care of You says, while you take care of baby, let us take care of you. Because a lot of times we go without or do without because we're so busy being the superhero in our own story, and realizing that sometimes we need to take that cape off and wrap it around ourselves. So I do appreciate each and every one of you. I do thank you. Do you have any questions? Okay. All right. Because like I said, I value your time. I value my time. I don't want to keep you any longer, but I do just want to say thank you, thank you, thank you, thank you, thank you so much. I learned something. I figure I think all of us learned something, especially the dental piece. Lord have mercy. I really, really appreciate it. This is a series, and this is the first one, and that I am so excited that you all have joined and to be a part of and said yes in one way or another. I want to thank the Parting Tribe. I want to thank my Coda Bear and Birth Equity Alliance for helping out with this event. And once again, if you look in the chat, you can find, if everybody wants to tell us where they can find us at, we can find you at, or where you're practicing at. Let's put it that way. Let's start with Nye. How can we find you?
So I'm putting the website, my email, and our social medias in the chat, but you can also call any of our offices if you are having a dental emergency or just need a checkup. Give us a call at 973-744-7003. But I'm going to put everything in the chat right here. Thanks.
Awesome. Thank you. Dr. Peace, how can we find you? I know you don't want to be found.
Through you. I'm not a big social media. I might be on there once in a blue moon, but my office is Clifton OBGYN of Essex, because we have one office in Clifton, but I'm only in the Glenridge office. So that's where you can find me. Of course, I never call my office, so I don't even know the number by heart. But the number there is 973-509-3888. I'll put that in the chat, and we can go from there. I know I need to work on my social stuff. All my patients are word of mouth, so I never had to do it.
Right. Shadira, how can we find you?
Shadira is in between jobs right now. However, I will be working out of Mount Sinai, New York, on the Upper West Side starting this fall. So if you have patients in the New York area, send them my way through ULA.
Awesome. Dr. Johnson?
So I'm with AMG Primary Care in South Orange. Our office address is 14 Vose Avenue, and our office number is 973-630-8989. I did drop my profile into the chat, and a lot of people look us up online, so you can take a look.
Awesome. Thank you. And Barbara?
My practice is fully virtual, and we can see moms from New Jersey, all over New Jersey, all over New York, and we're working on Pennsylvania and some other things. We do have an online presence. I'm not the best at doing it, but I do enough. And it's Therapy for Black Moms on Instagram with Black Just Be Okay. I put that there, and I put our website. Most people, we do actually accept most insurances except Medicaid, but we do have a therapy fund that we sponsor moms for therapy sessions if that is a barrier for them as well.
Awesome. Thank you. And also for the Parting Tribe and my Coda Bear, how can we find you as well?
The Parting Tribe, you can find us on Instagram at The Parting Tribe. Email us, thepartingtribe@gmail.com, and also website is thepartingtribe.org.
Awesome.
And for my Coda Bear, it's my Kota, K-O-T as in Thomas A. Bear.com. And we're also on Instagram, LinkedIn, and Facebook. And Instagram is _ my Coda Bear. And we also host, I did put in the chat, a monthly postpartum depression support group. It's a 3-week cohort. And as an incentive, we give 3 months of Pampers and wipes for those who attend all 3 classes.
Awesome. Awesome. Thank you all so much again. I truly appreciate it. Take Care of You can be found at www.takecareofyoullc.com. We are an additional support into all of these care providers as well. And you can also find us on Instagram, LinkedIn, as TikTok, and Facebook as well. Our next event will be next month. We do have an in-person birthing class at Shiloh Baptist Church, where we will be discussing labor, delivery, and beyond. And it is going to be fun. I'm excited about it. And I forgot about this. I also teach birthing classes at Mountainside Medical Center. Every month, you would just have to go on their website to figure out when I'm going to be there. So I do thank you all so much. I appreciate it. And you enjoy the rest of this Saturday. And thank you for coming in for Can We Talk Frontiers, who's on your pregnancy and postpartum team.
Thank you. Have a great day, everybody.
Thank you.
Bye. Nice meeting everyone.
All right. Have a good
Thank
weekend.
you, everyone. Bye-bye. Great job, Akira, everyone. Amazing.
Can we talk?